So virtual wards are when you are unwell and would traditionally needed to go into hospital, we actually now can treat you at home. So perhaps maybe hospital at home is a better phrase.
So a virtual ward would have traditionally been the care that you would have received in hospital, and we're trying to move services out into the community, such as IV fluids, IV antibiotics, monitoring such as your blood pressure, pulse, oxygen saturations, where these can be uploaded and monitored by a clinician remotely, with regular contact and input from them.
Patients with a whole range of conditions no longer need to be admitted into hospital, and we can bring the hospital into their home by delivering care within their normal residential setting. So that involves full comprehensive assessments from a range of multidisciplinary healthcare professionals. So that's doctors, nurses, physiotherapists, occupational therapists, as well as phlebotomists. But it also includes using technology where we can monitor patients' vital observations in their home, and healthcare staff within the hospital or within the general practice setting can monitor what's taking place in terms of the patient's healthcare.
A lot of us don't ever want to go to hospital, and indeed, being in hospital, we can become more unwell. Certainly being treated at home, there's evidence to suggest that, especially with respiratory illness, you have a better outcome and a shorter length of stay. In other words, less clinical input and feel better quicker. So actually being treated at home with a surrounding specialist clinical team is better for you.
So patients generally prefer to be at home rather than in a hospital bed. There's less chance of them having infections, DVTs, deconditioning happening, where they're not maybe as mobile as they used to be when they're in a hospital bed. And they're in their own surroundings, they tend to sleep better, and that's generally where patients want to be cared for. They don't, say for example, if they've got pets they're looking after, or they're looking after a loved one that needs them, they can stay at home and do that and get the care that they need rather than being admitted and taking them away from home environment.
What we know is that every single person is independently triaged. So it's an individual basis and decision of which you'll have an input into it all.
Well, the first thing to say is we do know that having a stay in hospital is harmful for patients. There are some healthcare benefits. Clearly, when patients that are seriously unwell can't get the treatment outside of hospital, then they need to go into hospital. But for the majority of the patients we look after on the virtual ward, who are patients with lots of medical problems, often elderly patients and patients who are frail, a hospital stay often does more harm than good.
So we call them step up and step down beds. So a step down is on discharge from hospital, they can be admitted to a virtual ward. So there are 2-hour urgent care teams in each area across Lancashire and South Cumbria that will admit a patient to a virtual ward and take all the details and explain what's going to happen to the patient. And they're also the team that will keep in contact with the patient to monitor them. In the same way, patients can be referred in a staff-up model from GP practices or ACPs in the community. Different health professionals and MWAs, for example, can admit patients onto a virtual ward that way through that same team, that 2-hour urgent care response team.
One of the final things, as we've heard, is that people are afraid that they can't be treated at home if they don't have any technology, or they're afraid of technology. Firstly, you will only be treated at home with your permission and agreement. So you are in charge here. The technology that we offer that enhances your stays either can be used on a smartphone if you've got one, or we can provide one. You don't need to have Wi-Fi because we can use a SIM card, but it's there to enhance your care. It's not there as a deterrent. And it's very easy to use. Somebody would show you exactly how to use it and to go through it. And most people pick it up very quickly and actually enjoy using it. They feel reassured by it, which is great. It is only enhancing the clinical input that you will always receive from an individual as well. It doesn't replace that.
It's quite simple and easy to use, but there's lots of support and training given to patients at the onset where they're admitted to a virtual ward. and we can go back time and time again to train people how to use the technology as needed. But generally, it's not a problem for most of the population. So that will vary according to the patient's needs, but generally it'll be a senior nurse or an ACP or a nurse consultant with input from GP practice and also consultants from the hospital. So there'll be frailty consultants, respiratory consultants, heart failure consultants, depending on what that patient needs, that will be spoken to, and we will be engaged in that patient's care. The virtual wards are available Monday to Sunday, evenings and weekends at all times, and it's obviously clinical nursing staff generally that they'll speak to, wraparound care from an MDT involving a consultant as well. So it's never usually just once a day monitoring, so it's usually a few times a day where people will be asked to upload the blood pressure and SAPs, and there's regular contact from a team that's usually based in the hospital trust. That would contact the patient, let them know if it's okay, if it's abnormal, if it's outside of what is classed as normal limits. So there's regular daily contacts, including weekends as well.
So the virtual element is really around observing them, monitoring them, keeping them away from the hospital, but there's no reduction in availability of staff. We travel out to patients' homes, whether that's in their own house or whether that's in a care home or a nursing home, and we take some of the hospital services out to them.
Yeah, I think the future is taking a lot of services out of hospital trusts and providing what would have been done in hospitals in the community instead. One of our teams are looking at constant wearables where you'll put a monitor on and that'll constantly Bluetooth the observations. So there will come a time in the future where patients won't have to take their own observations and upload them, because wearable technology is becoming more advanced now as well.
Well, what we do know is that in our ICB between December 22 and May 24, we have had well over 22,000 patients be admitted to a virtual ward, with a resultant saving of over 80,000 hospital inpatient bed days. That's quite a lot. It means that we can look after more people, that we can look after the sickest people that need that hospital bed easier. Takes the pressure off the ambulance, and we've all heard about those people having to wait in A&E before getting onto a ward. They're also more cost effective. Now, it's difficult to always quantify that, but we know they are much better for you as a patient, for the NHS, and for the system as a whole. So hopefully that's reassured you about what virtual wards are, how they can be helpful for you, and that it's an option for you moving forward.